Hey, hello everyone. Welcome back to the Convo Couch. This is Pastor Jardula. I am here today. We have a special treat for you. As you know, Fiorella is on assignment. So you just get my pretty face today, ladies and gentlemen. We're going to have a fun time. We put together a great panel. There's been a lot of discussion out there about what healthcare should look like moving forward. As a leftist, or traditionally what we used to call a leftist, I don't even know what that's called in the United States anymore. I was always for advocating our tax money to use to pay for healthcare because I thought it was more reasonable and more practical that we'd actually spend it on our own citizens over here instead of using it to expand empire. However, after what we just experienced for the last couple of years, I'm very weary about how that universal healthcare should look. And I think a lot of people's opinions have changed, and we need some answers. So what we wanted to do today was put together a panel where we can bring in different ideas and different ideologies to discuss it. I want to remind everybody today that this is not a debate. This is more of a discussion. It could be a fiery discussion if people feel passionate about it and want to get their point across. But we're here today to get answers. If there's a personal attack about a group, if they've been funded by dark money, all this BS, yada, 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 I don't want to hear it today. That's not what the show is about today. It's about looking at the ideologies of what we need moving forward. There's a lot of people who talk that, in a lot of other countries, they've already figured this healthcare thing out. However, just going a whole universal governmentally controlled healthcare might not work for everybody. We should also explain the funding mechanisms of how that's going to be paid for, because I know you hear that quote from a lot of conservatives. Well, who's going to pay for it? Well, we'll discuss that all here today. So I put together a panel. I should say we put together. My producers helped out as well. An amazing panel today with different ideologies and different groups. So let's bring on all panelists in, and we'll start to introduce them, and we'll get this puppy started. Let's bring them on in, Josh. All right, here we are. So we're going to start off with my good friend, Ricky Rance, who's there. Ricky, thank you for joining us today. It's great to have you on the show, the Convo Couch. You've been on before. You actually came on when you made the announcement when your Medicare for All movement started. So take a minute or two to tell us about yourself. I need water. To tell us about yourself, your group, and why you're here today.
Hi, my name is Ricky. I'm with March for Medicare for All. We fight for national improved single-payer healthcare here in America. I'm here today because we really, really need to have this conversation. I think it's something that is important to so many people in this country, and we all know there's something wrong, but we don't always know how to approach this topic. So I thank Pasta for bringing me on today.
Thank you for coming, Ricky. Love you, brother. And we got to have you on the morning show soon as well. Also here today from the Red Berets, but he's wearing a blue beret. And I hope I say his name right. Scott Desnoyers is here. Scott, welcome to the show.
Thanks for having me on, Pasta. Yeah, it was close. It's Scott Desnoyers. The S's are silent. And as you mentioned, my beret is actually purple and teal to stand for suicide prevention. I worked with the Red Berets after I lost my son when he was late paying a $20 premium to his Medicaid plan. Also advocated for single-payer universal health care, nationwide, improved Medicare for all. I also work on state legislation as well at the same time. Thank you again.
Perfect. Well, good. I got a lot of questions for you when it comes to state versus federal. I got a lot of questions so far for Ricky and Scott. As you know, I think I align more with you guys ideology-wise for a long time. I've always wanted healthcare. I said, why don't we use our tax dollars on healthcare rather than going around bombing other countries? But there are a lot of questions when it comes to that. Now for our third panelist today. He's an interesting gentleman. He might be considered the odd man out here because a lot of independent media shows that kind of lean on the left don't necessarily bring libertarians on. But I want to get the libertarian perspective because there is new management within the Libertarian Party. The Mises Caucus has taken over. In fact, I communicated with the chair, Angela McCardle, to connect with you. So today we have on Dr. Josh, who will be presenting the libertarian perspective. Dr. Josh, how you doing today?
I'm doing excellent. Thanks for having me on. I don't know if I speak officially for the libertarian movement, but we share a lot of the same opinions and views, and hopefully we have a solution that will resonate with a lot of people in a unique way.
Perfect. And Sleepy Josh is our engineer today. Sleepy Josh, if you want to say hello and give us a go that all the sounds are ready in place, and we'll start the game, and I will explain the rules to the crowd.
Hey, everybody, and we are all good.
Okay. So what we're going to do, gentlemen, is we're going to have you pick a number between 1 and 100. Obviously, the closest will get to pick first, the second closest will get to pick second, and the third closest will just end up where they're at. What we're going to do is if whoever starts off the process, they're going to get 3 minutes to explain to us what healthcare should look like in the future. You'll have a whole 3 minutes. You can go a little bit over. Like I said, don't go crazy. But after we get that 3 minutes, the other two panelists will then in turn get a chance to ask a question in an area which they don't necessarily agree with, where they think there's a flaw. We will then go, I will get a question too as well. We will then go through the discussion of that. And then to finish up that section, we will then give something positive. We will say something positive about that person's plan, just so we know that we're ending off on a positive note and we're here for discussions, not to tear each other apart. And we're going to do that 1, 2, and 3. And then we'll close out the show maybe with some questions from the chat and some other questions I have as well. So we're going to start number 1 through 100. I have written on over here. Ricky, I will let you guess first. What is your number?
57.
57. Dr. Josh, your number?
77.
77. Scott, Desnoyers, without a DS. You got to take your thing off mute.
68.
68. Well, the number is 19. You guys all went high. You're shooting for the stars. Ricky, you get the choice. Do you want to go first, second, or third?
I'll go third.
Ricky's going to go last. Scott, you get the choice. You want to go first, second, or last? First or second, sorry.
I'll go first.
Scott is going to go first. That means, Dr. Josh, you will be second. All right. So, Scott, I'm going to start the clock. Let me get it ready. I'm going to say something really quick before Scott gets to go, just so you know. If you don't know, Scott's got an amazing story. Just like many other Americans, and he says this in his story, he lost someone close to him because of a lack of finances to pay for healthcare, which a lot of us experience. A lot of people go bankrupt from healthcare in America nowadays, and it's sad. Scott had mentioned in his story that a lot of people have gone through the same thing. So, Scott, go ahead and take your 3 minutes and tell us what you think healthcare should look like in the future.
Well, the reason I wanted to go first is I wanted to make sure that within this 3 minutes, we can't talk about the future of our healthcare if we don't talk about the current state of our healthcare. Whereas we are sold these insurance contracts that profit by denying us healthcare, and they're sold to us by both politicians on both sides of the aisle. So what my vision of our future of our healthcare is a single-payer universal healthcare system. It is where everybody gets everything that they need that a doctor has deemed medically necessary, free at the point of service, regardless of their ability to pay for it. It is making sure that our children get the health care they need, our grandparents and those we don't even like get the health care they need to survive and live. This is funded through a single-payer bill that would be called in Congress. You can call it Medicare for all. You can call it anything you want, as long as we remove these insurance monsters from our healthcare system. And we pay for it the same way we pay for the failed F-35 bomb. We write it into the budget. That's how we pay for it. I believe the only way we get there is with a mass movement. We need everybody getting together on this, unifying, regardless of our differences on strategy or what have you. We have to do this together. We can't just say we need one hero here and there. We need everybody in the streets. We need to be bigger than the yellow vest movement was in France. Bigger. I don't know what
if
more.
If you want to take, you still got a minute and a half. If you want to tell us a little bit about your story, what propelled you to get into the situation?
I'm sorry, you were cutting up.
I said, if you would like to take the minute and a half that you have left to tell us why you got involved with this healthcare movement.
Yeah, the reason I got involved is my son was late paying a $20 premium to his Medicaid plan, which they cut him off of a medication with a known suicidal risk for withdrawals. 3 weeks later, he took his own life by driving his truck into the Mohawk River. I promised my son at his funeral that I'm going to make our lawmakers look me in the eye and see the consequences of their decision. I'm not a hero. I'm one guy standing up against these monsters, and I'm asking everybody else to join us. That's it. I need everyone to prove my words that no one fights alone.
Okay. Well, I'm going to start off with the first question, and then Dr. Josh he'll go right after me, and Ricky eventually will follow it up. My question is, Scott, we have different opinions out here today. There's a lot of people who are not going to be crazy about the fact that, who's controlling the system, which in this particular case would be the federal government, correct? Because it's a tax we pay, and they would have to manage it and whatnot. How do we unite people, Scott, if people don't agree necessarily in the ideology? Because I hear a lot of people will say, well, 76% of people, they believe in a universal healthcare system. However, when you get into the crux of it, they don't necessarily want the government telling them which healthcare they can have and what they can't have. In this last couple of years, there's a lot of people who've been hesitant about the COVID protocols and didn't necessarily want to get the shot. So telling them that they have to have a certain healthcare is kind of a little wonky. But I want you to tell me, how do we unite if we disagree so much?
No, that's an excellent question. And, it's something that I face every day. I mean, trying to unite everyone. I mean, that's why I brought up at the beginning of this, that we have to understand our current system, which is a corporate controlled healthcare system. They control all the dice and they profit every time they deny a claim. Now, in a federal bill, this way here, we can hold our politicians accountable by voting them out when they say that they're not going to provide, mental health as a human right. When they say they're not going to provide dental care or hearing aids to the elderly, we can vote them out. We can see their votes. You can't do nothing with corporate insurance other than change providers, but of course, only when it's open enrollment.
Dr. Josh, you have a minute to ask a question in an area that you're concerned with when it comes to Scott's idea of Medicare for all.
Scott, thanks for sharing your story. It's definitely very impactful. I'd be curious what system you would say is working the best or the closest to what you envision and how we might emulate that.
Well, I would say that if you look at every other foreign country that has a single payer system, Norway is a great example. We pay twice as much per capita for our healthcare system here in America. And as a result of that higher cost, that twice the cost, we die 10 years sooner. You could take any model other than the American model, which rates 37 in the World Health Organization's placement for healthcare, and find a better model.
So a couple of interesting questions and points. The Mises Institute does have a great graph where you can compare other countries to states. And I think that's one thing, you nuance that gets lost when we have these conversations. I don't have the map in front of me, but for, let's say, example, Norway is equivalent to North Carolina. So we're talking about, other countries that are the size of our states. So within a European Union or other countries, you will find pockets that do it better or worse, just like you would find pockets that do it better or worse within the states. That being said, I don't believe the stat is 10 years, but also it does come down to how we measure things, military deaths, infant deaths, etc. The stat you referenced, though, the WHO's study on grading healthcare countries is flawed, and flawed to the point that they never repeated it. For one, 60% of the points come from egalitarian distribution of healthcare, not healthcare outcomes. So Cuba, for example, waited until America submitted their data and then just said better data. And the WHO never independently verified every country's input. So that is a common point of reference, but has a number of flaws in it. That also being said, the statement that we hear a lot, we spend more on healthcare than any other country. Absolutely true. And do we get as much value for it? No, because I don't think any of us are arguing that our system is maximally efficient. That being said, David Goldhill has a great talk on this that says you can complete the sentence, America spends more than, on blank than any other country. We are the largest, richest country in the world. China being bigger but poorer on average. Same with India. So we spend more on TVs, on entertainment, on anything. So just spending more doesn't necessarily mean it's bad. It's how we're spending it. So,
Scott, you got a response to that too as well, because I also want to know, Dr. Josh, and before you answer, Scott, I mean, you're not implying that our healthcare system is good right now the way it's at, are you, Dr. Josh? And
I don't. I would be surprised if anyone here is happy with the system. I mean, given Scott's, I don't know if that question was me or Scott, so sorry if I jumped in, Scott.
It was to you, Dr. Josh. Yeah.
Okay. But just given your story, it didn't work, and that was a state-run system. I would like to think I have a somewhat similar story. My daughter has Down syndrome. She does not qualify for state Medicaid because we're not poor enough. And on some level, that makes sense. But unfortunately, if she was too sick, she also wouldn't qualify for Kansas state Medicaid. Kansas, like most states, has a waiting list of 4,000 to 5,000 severely developmentally disabled children that they won't let on Medicaid because they cost too much. So they would rather expand Medicaid to 150,000 working class citizens. And I get that, but where's the trade-off? 150,000.
I mean, I must argue your point. I mean, it wasn't a state-run system. It was a managed Medicaid plan bought through the ACA's New York Health Exchange. It was managed by a corporate insurance, Centene, which in 2018 made $60.1 billion by denying Medicaid patients the health care they needed. After the 2020, after the COVID, they doubled their value to $111.8 billion. This was a sister company, Fidelis Care, bought through the exchange that was owned by Centene. This was a multi-billion-dollar corporation that denied Danny his health care because he was late paying them $20. They denied him.
Yeah, I'd be curious though, and I'll plead ignorance here, although maybe it seems like something I should know. Is there a state that does manage their own Medicaid? Because even the federal government doesn't manage Medicare, right?
Yeah, I'm not totally sure. I know that in New York, if you have both Medicaid and Medicare, which is the situation I'm in, you have no choice but to use an HMO, managed Medicaid, Medicare, which is why my dental situation is as bad as it is, because most people are aware Medicare only covers one cleaning a year. And that's my primary insurance through the dual advantage flex programs. So finding a dentist is horrid.
Sure. And I guess, and how would we solve that going into, what you're saying is double down on government run care? I'll side with you on that to some degree, because clearly that mistakes are made, and we're not here to defend that aspect of it by any means. But I'm looking for, like, what is the example of a solution that we could implement? What state is managing their own medical care well? And if they aren't, why not? A parallel would be most states are running their own schools, but still struggling. So
I mean, why not is his same answer as always. It's because of the money. I mean, politicians' campaigns are paid for by campaign donations by these insurance industry. That's why
I won't disagree with that. But if the government isn't doing the actual process, right, deciding what payments are made and reviewing the claims, then we'd have to create a body to do that. And we might save some, but would we still be under the constraint of a budget? And if we were,
I'm sure there would be a budget constraint, and it would, again, that would come down to the voters at this point, would it not?
I think this is going to be a common debate today, like as far as like, okay, it's being mismanaged, we got to just get the right people to manage the system, versus anytime you have a corrupt system, a government, it's going to turn corrupt because power corrupts. And I think that's going to be a conflicting ideology today between our libertarian friend and Scott, and maybe even Ricky and stuff. But before we get deeper into this, I just want Ricky to get his question, and then we can continue to dive into the whole situation. Ricky, go ahead and give your question, or if you have anything to say about what Dr. Josh and Scott are talking about here, because really, to tell you the truth, for me, it's a quagmire, right? I mean, I don't know if you guys know how I feel about elections. I feel our election system is way more messed up than our healthcare system. It's beyond repair, and that's why we have pretty much a 20% approval rating, if that, from our whole Congress. Go ahead, Ricky. Jump in there.
Yeah, to piggyback off of that, because I think Scott and I, our end goal is very much the same. So I don't want to pick apart what he's saying there, because we agree on most of those things. But the voting thing, I will say, I don't think we're going to vote our way to a healthcare system. You were talking about voting people out. I don't even know if we can vote people out. I feel like if these parties want certain people in, they just make it happen. They smear people. They will literally rig primaries. The DNC literally admitted that they can rig their own primaries because they're a private entity, which is the craziest thing I've ever heard of in my entire life. And then they preach democracy left and right. So do you think voting is actually going to get us healthcare, or do you think it really has to come down to that mass movement that you were talking about earlier?
100%. And when you get that mass movement, Ricky, you and I agree with that as well. I mean, 100%, we have corrupt politicians, we have corrupt elections, and yes, but it has to be the mass movement. And, we've had our disagreements. And again, I am telling you, we have to work together. We have to unify. We have to get people out on the streets. My main goal here is to get people active before they have the incentive that I needed to get active.
Yeah.
I don't need them standing on the sidelines cheering for us, saying, wow, you guys are doing a great job. Get the hell out here and join us. I'm not doing anything that they can't do.
Yeah. Well, Dr. Josh, if you have anything to say to finish up your last statement too as well. I'll say it again. This is the quagmire here. A lot of people will say that government is the problem when it comes to healthcare, and I believe it is, because they work hand in hand with the corporation, with the medical industrial complex over here. So if government is the problem, how does more government fix it? I mean, that is the quagmire we're facing today, and that's why I wanted to have this panel. Dr. Josh, if you can finish up on your statement real quick, or any other thing you have before we get to the kind part of this segment, which is telling Scott what we think is good about his plan.
I think I'd say, I don't know if this bleeds into the next comment, but overall, I would agree with a lot of what we said. I don't think it's going to be difficult to vote ourselves in. The election system is complicated. It's slow. It's not without its issues. And so I look forward to talking about solutions that we could rally people around, like Scott's saying, in a grassroots movement, but eliminate the hardest part, eliminate the piece that's not working, and look for what I would call new solutions.
Yeah. Ricky, what do you like a lot about Scott's plan?
About national single-payer healthcare?
Yeah. What do you like most about it?
Well, that'll be part of my 3 minutes probably, but it covered. I mean, everyone's covered.
Yeah.
Boom. Everyone's covered, and it really isn't a government grab. It's not what I feel like. A lot of people think Medicare for all means, the government runs everything, and that's just not what it is. If we were talking about nationalized or socialized medicine like the NHS, there would be a lot. The government would be everywhere. With Medicare for all, it's the payment mechanism is what changes. The government doesn't come in and run the hospitals. That's not how that works. Private hospitals are still private. Private clinics are still private, and private practices are still private. We do have to make sure our healthcare workers get taken care of, and we need to make sure our hospitals can keep the lights on and can expand if they need to, right? But those things stay private, so you still have that buffer, between the government and the people, the patients, right? So that's kind of, in my opinion, that's the happy medium, and we can talk more about that when it's my time.
Perfect. Dr. Josh, you got something nice to say about our friend Scott over here and his plan?
Yeah, I think for me, it's the passion. We can disagree on how we get there, but I think what we all want is more care more often for more people, right? We want a faster, easier, cheaper healthcare system. And that's what Scott's, championing. And, the devil's in the details, but we share the same endpoint in a lot of ways, I'd say.
Scott, does your plan eliminate insurance single payer insurance companies?
The ones who murdered my son? Oh yeah,
Yes.
yeah.
Okay. I listen, this is something when it comes to a lot of conservative people, and I couldn't find a conservative person to come on the panel, is that we want the right to stay on the phone and listen to dead air for 26 minutes and then not get the answer we want and to get screwed over and stuff like that. So if there's an option to eliminate insurance, then I'm for it. However, does your plan, does it allow people who want to be annoyed with these insurance companies still have insurance if they want it, or no?
No, nope.
No insurance.
33% of our healthcare cost in America is how do we pay for it through insurance corporations. They do nothing but profit from denying healthcare. They have a money incentive to deny us healthcare, and they use that incentive to their advantage. Yes, no, okay. I will not let them kill somebody who's ignorant to what they're there for.
Scott, thank you so much for sharing your plan with us, and we will get to the next part, and we look forward to hearing more from you as we go along. That's Scott Desnoyers. I can't even say his friggin' name. I'm so bad at it, whatnot and stuff. Anyway, Scott, thank you so much. That was awesome, and we still got a lot more show to go. Dr. Josh, you're going to have 3 minutes. I know you're going to have something to say maybe about the fact that if you want to have insurance, you should have the right to have it. You know, I don't know why you would want it, but I once again, that's a problem I have sometimes with the other guys, my friends over here, their plans, because if you believe in freedom and liberty, which the Libertarian Party is strong on, especially with the new management of the Mises Caucus, you should have a right to have that insurance because that's your choice. So give us your 3 minutes on what you see healthcare is moving forward. And if you can take a couple extra minutes, being that you're a libertarian and it's going to be pretty new to a lot of people out there, I'm looking forward to it. Go ahead and take that 3 minutes, my friend.
Thank you. Yeah, fun conversation. And I think that the solution is actually something most people haven't thought about, right? Steve Covey has a great book. It's probably not a left or a right issue. It's a third alternative issue. It's something that we haven't seen in a grand scale because what we have seen is things that isn't working. And I don't really think healthcare is a left or right issue. Like you said, no one's arguing for bad insurance and no one's arguing for bad government. What we want is, like Peter Thiel would say, better, faster, cheaper, easier. And I'm a market believer. And I think the market can actually fix this to a degree where I may be guilty of semantics here. The government is insurance. So you either pay more taxes for insurance or you pay a company for insurance. But what we need is insurance that works. Car insurance, home insurance, life insurance, those all work because they're all actual insurance companies. And what we've done, and I blame doctors, honestly, more than I blame the insurance companies, because the doctors are the ones actually providing the care. The insurance company is just an actuarial payment system. It's not making medical decisions, right? It's not innovating. So what we do is a direct primary care system. Insurance is for rare, expensive, infrequent things, right? Big things. It's not for your medicine that costs dollars a month. The idea is not that insurance is bad, it's a tool, and we're using it in an inefficient way. Right? So if we talk about power and electrical energy and things, the phrase is too cheap to meter. And what I see, what we've done for the last 12 years, is create healthcare that's too cheap to insure. And I honestly don't really care who pays for it, because who's paying for it is a second or third or fourth level question. Is what are we paying? Is the most important question. So in our model, it's $10 a month for kids, $50 a month for most adults for unlimited home visits, work visits, office visits, telemedicine visits, no copays. Any procedure that we can do in the office is included free of charge. Stitches, biopsies, joint injections, ultrasounds, DEXAs, Holter monitors, barometry, etc. And we also add value by innovating. We provide medications and labs direct from the wholesaler, basically, for up to 95% less, sometimes more. I've got a graph I shared that Walgreens will charge, worst case scenario from goodrx.com, cash price for a seizure medicine, $108, that we get wholesale cost to our patients $1.32. So when we can look at things like, now your seizure medicine's $1.32 a month. Well, the state of Kansas is paying $400 a month for the same medicine. All right. The problem with the Medicaid solution is that, not that it's bad. I'm not here to say government's good or bad. I'm here to say it's inefficient, and there's not a mechanism in place for them to kind of grind against a competition. No one's there innovating to make things better, faster, cheaper. When we can provide that level of medicine, we're 80% cheaper than Amazon, we're 70% cheaper than GoodRx, and we're 45% cheaper than Mark Cuban. I like to joke there's not a billionaire alive who can get meds cheaper than I can. When we do this, we decrease the cost of health insurance premiums by 30 to 60% in the first year, right? So again, if we back away from the conversation of who pays for what and what are we paying for, then if roughly 14, 15% of the population is uninsured at any given time, we only need to fix health insurance by that amount. But if we decrease it by 50% nationwide, that would be, a rough savings of $10,000 per family per year. That would be an economic boom that would last a generation. That would pay off debts, the average household credit card debts of 6,000 or 7,000. It would revolutionize what people are doing. And it's not just healthcare, it's the dog that doesn't bark, right? It's the broken window fallacy. So, Scott's son had, a very unfortunate situation compounded on the fact of years of opportunities, I think, that didn't exist because jobs and employers and all these things are dragged down by health insurance that cost twice as much or more than what it could. So then if we get to a system that works, well then sure, the individual can pay for it, the family, the employer, the government, state or federal, charity, all those dollars go.
Okay.
I think Scott and Rick would agree with me. You can't triple the budget of a state, but I can increase the purchasing power of the state dollars by 100 or 200% easy, if not more. So we can get to the same endpoint.
Okay. So if you give 15 seconds to wrap it up real quick, and I have the first question, and it's going to be kind of like a gloss over question, and then Ricky will be on deck.
Sure. So in general, we've helped over 1,800 doctors convert to this model. We've helped over 1 million patients. We've been at this for going on 12 years. So we do have a lot of experience in showing that this works. I appreciate there'll be a lot of questions, concern, debate, disbelief, but it is a functional model that could be applied much easier system-wide to help as many patients as possible.
And you're operating in this model right now?
Correct.
Okay, so you do have examples, because that was always like, well, give us an example. But my question before I hand it over to Ricky, and I'm going to let Ricky go, is this is the part of libertarianism which I have a hard point dealing with, right? It's the economics. I'm for a free press. I'm for freedom of speech. I'm anti-regime change. Those are the things that made me matriculate to the what I call the great compromise, where I'm willing to compromise to get those things, because I do think they're important right now. Those things are more important than anything else to me personally. If we lose our speech, we lose everything. However, when it comes to the economics of a libertarian, this whole idea that the free market's just going to work itself out. And this is where a lot of people say, well, this is where libertarians lack compassion. What do you say to that, and to the fact that a lot of people just don't believe that the free market is just going to work itself out, that it's still a form of capitalism, and those who have the enormous amount of capital will always swallow up the small people down below?
I would say, given the data they have, they're correct, right? But the future is here. It's just unevenly distributed. And so the people unfamiliar with what we do go to Walgreens and see medicine that's $100 a month. The people who come to us see that same medicine for $1 or $2 a month. So it's a data-based reality. And yeah, the market hasn't been great on helping healthcare overall, although we have cures. We don't appreciate that we're living in the future of modern medicine, where 30, 40 years ago, we couldn't treat half of what we can treat now. Some of my best medicines are, generic that were blockbuster medicines or were, brand name only 10, 20 years ago. So those patents wear off and now we have amazing stuff. So we don't want to forget how far we've come. But also if we improve the economics of this by 50, 60, 70, 80%, it narrows the gap so much more and solves the problem. So every doctor could do wholesale meds, every doctor could do wholesale labs, every doctor could do a membership model, decrease insurance premiums, and almost like a food stamp model where we have lots of grocery stores, we have lots of people buying food with very minimal paperwork. So I think we take examples of what works best from the government. The government's still a payment source; they'll never not be that, but they don't have to be the first payment source. And when they are the payment source, they can treat it like they are a big consumer. But you can pay for patient care or paperwork. And the government doesn't have an example of it working out very well. We have more people in a socialized universal healthcare system now in the US than any other country, just by the fact of the number of Medicare, Medicaid, Indian Health Services, and VA patients that we have. We are the largest universal healthcare group, effectively. And it's not working out great. And Canada doesn't have great outcomes, and the UK doesn't have great outcomes. So it's not just the market. Half the argument is the market can't work, and the other half is that everything else is working. And neither one of those are necessarily true based on the best data.
Ricky, go right ahead.
This is very interesting. So thank you for sharing. You say you work on this wholesale type model that you think more doctors could implement. Why don't you think it's becoming? Why don't you think it's catching on really quick? If they could, if they could make their money, the doctor, and help their patients save money.
Yeah, a very common question. So I would say it is growing really fast, but it's relative. So when we started, 2010, there probably weren't, a dozen clinics like us in some fashion. And now we open, 20 clinics like this a month. It took Starbucks 16 years to get their first 17 stores. And they had, experienced business people behind them, and they were just selling coffee. Healthcare moves slow. Doctors are skeptical. They're afraid of risk. They're afraid of business. Societally, from a societal standpoint, they're often criticized if they open a business and, quote, focus on the money. And I blame med school for that in a lot of ways, because there was this idea that if you focus on, quote, profits, that you can't be a caring clinician. But I would say it's the opposite. How do you care for your patient and not focus on the economics of it, right? I took an oath to do no harm. To me, the most important harm I need to help my patients avoid is financial harm. I'm not protecting you from cholera. I'm not protecting you from, damage and trauma for the Wild West. I'm trying to prevent long-term illness. I'm trying to prevent financial ruin. I'm trying to prevent them from being afraid of managing their cholesterol because they heard it costs $100 a month. No, it costs $1 a month. If we do it right, it costs $4 a year, depending on which medicine we choose. So if we demystify the finances of it, more patients will request it, more doctors will feel supported, and it's just kind of this growing movement that parallels the worse the current system gets for doctors and burns them out, and then the longer they see evidence-based practices of direct primary care working, then the more comfortable they are making that leap. So it's still a grassroots movement. That's where I appreciate Scott's enthusiasm, because that's the only way a movement grows, is actively engaging the people most negatively affected by the current system. If you're a poor patient working, second shift at a call center, going to the doctor for a migraine means going to the ER, which is almost analogous to debtor's prison, because they're going to charge $1,500 for something I can do for $2, right? But average patient can't call, text, email their doctor and have their doctor come in after hours to help them. So we want to bring that model to the masses. And it's talks like this that get that information. Is once patients know there's a better mousetrap, they demand it, right? They, especially in a year of double-digit inflation, they need their dollars to go as far as they've ever gone. So the patients actually get it faster than doctors because they hear better, faster, easier. You mean the med I'm paying for is for $100 I could get from you for two plus $50 a month, and that includes unlimited other stuff. That if I ever need stitches, I'm not worried about going to the ER. I just come to you. That's a huge value add that we can bring. That the criticism we hear the most, ironically, is, well, this sounds great for rich, healthy people, which to me makes no sense. Rich, healthy people are both healthy and have good insurance. It's poor, sick people who get the absolute most money from this. To lean on Scott's example, and I hope I do this respectfully, patients with depression and anxiety and trauma often don't use the healthcare system well, right? Because we've made it so hard for them to, quote, use it well.
Yeah.
Is, okay, you have to call and wait on hold, and then we'll give you an appointment for your urgent thing 2 weeks from now, because the system is, my patients could text me and get a response within a minute, right? And that's almost the level of simplicity you have to bring it to. So when anxious people are ready to say, hey, I need help, you're right there for them. That when they need medicine, they're not worried that it's going to be hundreds of dollars. It's Zoloft's $1 a month, right?
Yeah.
So we've almost, it's a problem of our own making, because we've told everybody for decades how complicated the system is, and it's almost emperor's new clothes. We want to believe the healthcare system is broken. It is, but we also kind of struggle against that there's a fix, and there is. And so our passion is knowing that the poorer the patient is and the sicker they are, the more we're able to help them proportionate to their budget, right?
Yeah.
It's one thing to save a 1% or $100. That doesn't mean much. You save a person working, minimum wage, $100 a month, you've changed the course of their life indefinitely. If they put that money away for, each month for their kid, that pays for college. Right?
Let me go to Scott, because Scott, what the doctor's talking about here makes a lot of sense, right? It's finances. We understand how economically the healthcare system is bankrupting people, crushing them, all the red tape that you got to go through. Scott, do you have anything to say to the doctor right there? Because when it comes to finances, I mean, that seems like something where a lot of people say that libertarians are lacking compassion, but if they save people money and people can access the system easier, isn't that a good thing? But Scott, please go right ahead.
Yeah, I have actually two different points. I mean, one of the problems with putting healthcare on the open market is, like Dr. Jarvis says in the documentary Healing Us, you can't put a market value on something that is not of use to you. So it's not there is no cost that you can lower the cost of insulin to that it will be necessary for me to or ever want to buy insulin. I will never need insulin, even if it was $0. In a market, you can't sell me insulin. However, there is no amount of money that I wouldn't try to pay to get my Plavix. You can't use a supply and demand model on our healthcare system. A medical rep was caught saying that, it costs this much money. However, nobody's going to complain when grandma's on the table, which is true. The other part of that
Plavix is 75 cents a month.
Yeah, but when it first came out, it was $800, and I would have paid the $800 out of pocket to get it. So supply and demand does not work in our healthcare system, is my point with that.
Yeah.
And
Josh, don't go to the second point. Let's talk about the first point, and then we'll get to your second point. We'll give you two follow-ups, Scott. Dr. Josh, address that issue that Scott talked about, because it is true. When sometimes if a needed medication comes out and it's very, very expensive, I mean, how are you going to lower that cost if the market sets that drug at $800 a pill? Go ahead.
So I think it's a combination of things. One, I would argue we have a broken pricing model for prescription drugs that's not entirely the pharmaceuticals making, right? That's government bureaucracy that slows things down and adds red tape. So that one of the guys I studied with through med school, his dad was the lead pharmacist investigator for Allegra. It took 2 semi-trucks full of CDs to distribute the necessary data to the FDA to get review of that medication. I would imagine we can simplify that. If that's what an allergy medicine is, what is the other complexities? So, and I'm not here to hold water for pharmaceutical companies, but we do want them to be profitable. Because Malcolm Gladwell said this, of course, well-known prolific author on Medscape, interviewed maybe 2018. A quick example is $1,000 hepatitis pill. It's $1,000 per pill, and most people rail against this idea. This is unaffordable. The problem is it's a cure for hepatitis C. We've never had a cure before. And the current annual cost of treatment is $140,000 indefinitely, right? So it's perspective. A $90,000 cure once versus $140,000. We want to incentivize people to make blockbuster medicines. The problem is, and this is kind of where the fact that a lot of the data points are lined up in the wrong order, is we don't want to pay for health insurance that costs $1,500 per month national average per family for things when 80% of people aren't using it. We're paying for the wrong things. Health insurance should cost $400 or $500 per month with no deductible, no copay, and cover you for 99% of things. And then you'd have $1,000 extra back to your life for the course of your life, right? So that's $12,000 a year for 30 years. That's enough to retire off of for most people. So then, if a medicine were to come out and cost $800 a month, at least they have to show that it's worth it. And when the consumer's paying, I think what you would see is those prices would be more reasonable. They are high because of a broken third-party payment system. And that's true because of a government process that set up the insurance. It's true because of the government rules on the 85% corridor that prevent health insurance companies from lowering premiums, and I'm happy to explain that. And so we have a broken system. The Kansas State Medicaid, the example I'm most familiar with, is overpaying for medicines, and they'd still be overpaying for brand new medicines. So we would still need a mechanism in place for whoever pays. And that's sort of where I take this from. I always think it's the patient paying, whether that's directly paying, hence direct primary care, or the patient paying their insurance that pays for it, or the patient paying taxes and the government pays for it. Who pays is less relevant. What they're paying for is the real crux of the question. But if you decrease the cost of 80% of care by 80%, then it takes a lot of the pressure off of either private or public insurance to cover these things. But then now you would have the dollars to cover the name brand medicine if it was a cure. The funny thing is, going forward, statistically, 80-20 curve, we will have fewer and fewer of those blockbuster medicines because we've had so many of them and they're generic. So we did have to live through a time where Plavix is $800 a month to get to the point where Plavix is 75 cents a month. Let's ensure the things that are big and expensive and scary, my house burning down, but not insure my groceries, right? Not insure my lawn care. And it's this dual, multifactorial solution. Fix the economics of medical care first. And again, that's where I blame the doctors. The doctors have to take charge of that long before government, good or bad, or insurance, good or bad, can change how they pay for something. So we can't
I'm so sorry to interrupt.
I'm
before Scott gets to his second point, Ricky, do you have anything to say on that first point too as well? Because I know the chat lit up too as well when Dr. Josh said we want the pharmaceutical companies to be profitable. I know a lot of people were like, and stuff, but do you have anything to add on that before Scott gets to his second point? I mean, I know what he's trying to say, Dr. Josh. He's not trying to say that a predator class should make more money over here. He's staying within his parameters of economics where it's, it should be allowed where people can make profits, where you should be able to make profits, where anybody should be able to make profits. And so I know what he's saying. I don't necessarily agree with it. It's where I have a problem. But Ricky, do you have a follow-up to that before Scott gets to his second point?
Well, just really quick. Our big pharma is extremely profitable, probably more now than it ever has been. Not only because, they've kind of squashed all the competition and they work, tight. They're very tight with the government. There are these public-private partnerships, which are basically almost criminal, to be honest. Tons of grant money floods into certain companies, not just, basically the big powerful companies get more free money to make more products and they double dip by turning around and selling that product. So they make tons of money, which gives them more power, which allows them to squash competition. So there is no free market when it comes to big pharma. There are tight relationships between these big companies and the government, and that tight relationship it squashes competition, and they start colluding together. And now you're starting to see that the FDA and the CDC and all these other government institutions have been like footing the bill when there are lawsuits. There's actually a vaccine court in Washington, D.C. It's the only industry that has its own court in Washington, D.C. where the government foots the bill for lawsuits. You know what I'm saying? So, and they do this with all kinds. Like, go back to Vioxx. Like, Vioxx killed like 60,000 plus people. And they knew that it was killing people, but who covered it up? Both the government and Big Pharma. So we have to be very careful when we say we want our pharmaceutical companies to be profitable, because it's a much deeper situation that we have going on here.
Dr. Josh, I'll let you address that really quick, and then we'll get to Scott.
Yeah, I guess I'd ask Ricky to define a free market, because I would say we have a free market in the pharmaceutical market as we've described. My second question would be, if government is part of the problem now, how will it not be part of the problem later?
Ricky? That's a good question.
I don't know that we really have a free market in America. I don't even know that we have democracy in America, to be honest. These are some terms that we love to throw around, but I think we throw them around a lot because we really want these things, and our politicians definitely like to throw these terms around to sell us on the idea that we have these things. I don't know that we really have these things. When the government starts colluding with corporations, I mean, that's a fascistic relationship, is it not? So
I wouldn't disagree with that, but that might be overly splitting hairs to evade the question. You're right. Could we have a more laissez-faire market? Absolutely. On some libertarian level, the government's involved too much in the market when you have to go through like 1,500 hours in Kansas to get a hair braiding license. Those types of things the Libertarian Party has been really consistent on. Like, so laissez-faire, no, but we have a market. And I think what, if I could press you just a little bit, is the evading the question. We showed that meds are 95 to 99% cheaper in a market-driven answer. Free market, probably not, right? A free market would be maybe, non-physicians could get the meds, but we're probably not going to get that free anytime. And I don't know if I would advocate for that, but we did make them so much cheaper that they're too cheap to insure. And now whether the government pays with that for a food stamp or the patient pays for that, but Plavix for 75 cents a month is a solution that fits into your model and fits into a libertarian kind of freedom-based model. Would you not agree?
I mean, I'd have to really dig into what you're doing over there, because I haven't really explored the model that you're working under. I think I'm glad that you're doing something, because patients are struggling out there.
If I sold you our model to support your model, the idea that we could make 80% of primary care 80% cheaper, that makes it easier for you and Scott to afford whatever it is that you want to build. Right? So a public-private mixture of these things, I'm not advocating necessarily for that, but I want to show how we overlap more than we don't, I think. You want cheaper meds. Scott wants meds with maximal level of access. And whether we call that free or not, somebody's paying for it, right? So the government or an insurance company, someone is paying back the pharmaceutical companies, because it's kosher to say, well, we want nurses and teachers and firemen and people to be profitable, to be paid a fair wage. And the only way to do that is somebody has to buy those meds. So if the government's buying them at 75 cents a pill because of a market-based solution, that supports a universal system that you guys are talking. So in essence, the government can't functionally get to an affordable version of what you guys are talking about, as I understand it, without a market-driven answer to 80% of care.
Scott, you got your second part, or if Ricky, if you have a follow-up after, you want to think for a second, let Scott get to a second point, and then we'll circle the wagons. Go ahead, Scott.
Well, my second point is actually still 100% related to the first.
Please
do. The problem that I see with both, is you're leaving two very large corporations in play that have been proven over and over again that their profits are more important than the healthcare of the patient. The pharmaceutical company and the insurance industry both profit multiple times by leaving us suffering. Marijuana legalization is one simple point. For 70 years, how many millions of people have suffered and had to go turn to opiates rather than having a natural, holistic, medication that was easily available. They would rather sell us a treatment than a cure if the treatment is going to get them more money. And as Amy Villela said, insurance companies are beholden to their shareholders. They can actually get sued if they don't take the best interest of their shareholders in place.
True.
Rather than the patients.
But they have a government limit on their profit margins, so what we're talking about is bad government relating to bad insurance. But the 85% corridor, they have to dispense 85% of their premiums back towards patient care, which creates a perverse incentive for them to not innovate. You're actually talking bad government led to bad insurance. So
my point being is they have an incentive to deny healthcare, and they do because they are letting people die to line their pockets, and they're not just people.
Let Scott finish real quick. 1 second, Dr. Josh. Go ahead, Scott. So the audience can hear, because I was missing up. You say they have an incentive, and who is they? The insurance companies. Go ahead.
Insurance companies have an incentive to deny health care to their patients. They have claims. And they claim they're going to pay for this health care when you need it at the time you need it. Except if you're out of network, if you're out of, didn't pay your $20 premium, if you had a pre-existing condition before the ACA came around with that, and every other loophole that they can find. They go out of their way to put these loopholes in place to try to limit our care, and even just trying to go through those loopholes to get that care cost us lives. Over 68,000 lives a year. Treatment that was necessary, that was medically available, that would have saved their life, that they couldn't afford. And with your system, you're still leaving people that can't afford the 75 cents per pill out. So there are people who don't. Go
ahead, Doctor. Let Dr. Josh address you, Scott, on that. Let him address you on that. Scott, go ahead. Dr. Josh, go ahead.
For the sake of argument, Scott, though, I'm agreeing with you, right? That there's bad insurance because of broken system, inefficient as it is. But the 85% of all the money they get has to go to patients. So other than the administrative cost and profit margins are 3 to 5%. The administrative part, which is admittedly burdensome, I don't know if they could approve much more care at the premiums they have, right? Is it wrong? Absolutely. Could it be better? 100%. But the mistake is saying that it's the insurance company by themselves creating these bad issues. It's bad government creating rules about a system that's so complex they couldn't possibly understand it, right? I think we're asking the impossible of our legislators. You couldn't ask either party to fully understand all the complexities of a healthcare system, a health insurance system, a food system, a welding system, an agricultural system, an airline system. But yet we give them the authority to make these rules, and every time they do, it's monkey's claw. The Affordable Care Act was meant to lower premiums, and it raised premiums because what it did was focus on premiums and not focus on what we're doing, which is actually lowering the cost of care. Now, I think the number of people that honestly can't afford 75 cents is low because that's 75 cents per month.
There's still people.
3 cents. I'm not saying there's not. I said it's low, right? And so there's always the role for charity, for state government, federal government. I'm not necessarily arguing that we remove them, but what do we do and where does it work? I would argue food stamps is something that neither the left or the left is probably proud of and the right doesn't fight too much. It's a market-based approach The invisible hand of all grocery stores keep the cost of milk pretty reasonable with no paperwork required from the government. I would argue that the food stamp program works too well because we have poor patients on Medicaid with enough food to become obese enough to be a type 2 diabetic. So we have a lot. Sure.
Dr. Josh, just finish up for 30. Are you done? Or do you, Scott, jump in there and then let Dr. Josh.
Yeah. If we gave people power to shop in the market and fix the market side of it, then the government would still be playing a role. And someone like your son could take in a card and have healthcare with dignity and have it paid for, but we say, here's $100 a month. And if that's enough, we have a way to decide what's enough for a household for food. And if you have a baby, we give you more, et cetera. Imperfect as it may be, it's better than other examples of healthcare delivery. And so then, Zoloft or something would be $1 a month to help with depression and anxiety.
All right, let Scott respond, because I'm still lost here, because I like both sides, guys. I'm really having a hard time searching for the solution here, because what Scott, what you're still advocating for, and correct me if I'm wrong, is still just government to still run the same system, but just straighten out and fly right. And I have a hard time with that. And when you talk about the free market, what's to say if, a doctor doesn't want to give this person a life-saving medicine he needs, there's no oversight whatsoever. That doctor can do what he wants to do based upon a grudge or something. So, Scott, if you have something to follow up, and then we'll let Ricky go, and we'll wrap up Dr. Josh's segment and move on to Mr. Rance. Please do so, Scott.
Yeah, as said, again, my whole problem is with profit-driven incentives in our healthcare system. First off, somebody who is poor, who can't afford a treatment that maybe it's within their reach, but they really have to put out everything they have to get there. Now, they can be jumped in line by somebody who's like, hey, doc, I've got a couple extra $1,000. And that person who might need that care more is going to be left behind, because the doctor has an incentive to make more money elsewhere. The same with insurance, the same with pharmaceutical company. We have to remove
the same with the government, though, too, right?
100%. We have to put patients first. We have to, and with a single payer universal healthcare system, other countries have figured it out, and they're doing much better than we are.
Dr. Josh, take 1 minute, respond to that. Ricky, I'll let you get the last statement over here, and then we'll get to your section.
So actually, I would argue at least 3 of us wouldn't qualify for surgery in the UK because it looks like our BMI is too high. Ricky looks to be the thinnest. So I wouldn't be so quick to say that other countries have figured it out. There's countless examples, it's just they're often underreported, of Canada denying care. Or if you need a cataract surgery in Canada, they have a budget. They've predetermined how many cataract surgeries they'll do this year. And come November, if they've done them all, sign up for next year, right? In fact, in 2005, there was a lawsuit that went to the Alberta Supreme Court because of a lawyer who got a hip fracture and had to wait years for surgery. Long story short, they concluded that the wait list was so long for Canadian healthcare that the judge's statement was access to a wait list is not the same as access to care, and the wait times violated the Canadian Human Rights Treaty. Yeah. So other countries haven't figured it out.
That could be a myth. A lot of people say that. I haven't tested the healthcare systems out in other countries. I know my partner now with her new job, she gets healthcare, and I heard it's pretty damn good, but who knows? Ricky, I'll give you the last statement for here before you get your 3 minutes. Scott, if you have another question, just write it down. We'll hold it. We'll circle the wagons and get back. This is great discussion. Go ahead, Ricky.
No, I think I've heard a lot. I really just want to dig into your world a little bit more, because that's the world I haven't. That's like a perspective I haven't heard so much, the whole wholesale model. Although I'm always worried about how privatizers will enter that realm once they understand what's going on. Yeah. So that's really all.
The only reason why I'm peeking my head in the door over here when it comes to the libertarian movement as far as healthcare is because government has failed us so goddamn much on every single step of the way, right? And I used to think that, hey, man, and this is before I understood what our elections were about, we're just electing the wrong people. But now when we have a disapproval rating of almost 80%, where 80% of the public doesn't even like or approve of the Congress, Something smells rotten in Denmark. Dr. Josh, thank you so much for your statements. Let's kick you to the side. Ricky, you're up. Everybody's been saying Ricky's been so patient. He's been waiting. Would you let Ricky speak? Ricky, give it to us. You got your 3 minutes or a little bit plus, and then I got some questions at the end. I think we're missing the big point over here, which I'm going to bring up once we get done with this section, because this is something that nobody's brought up, and it really bothers me, and we'll talk about it after Ricky's section right here. Go ahead, Ricky.
Okay, well, here I am. So where we're at right now with healthcare, we have this thing called the Affordable Care Act, Obamacare, which is actually just kind of rebranded Romney Care. So this is a two-party problem. Both the corporate Democrats and the corporate Republicans kind of dumped us where we're at today. Obamacare is a corporate handout. Definitely something that's left tens of millions of people uninsured and underinsured. Right. So we have a massive problem with the current system, and we're all in agreement on that. We also have direct contracting entities right now, which definitely affects our seniors probably the most. Medicare Advantage is one big problem. A lot of seniors walk into Walgreens or CVS, and there's these little minions running around trying to get these seniors onto Medicare Advantage, which is just more privatized healthcare. And sometimes they can pay up to like $6,700 annually out of pocket. And these are people that are on a fixed income, right? So everywhere you turn, there's trying to extract as much wealth out of patients as possible. Amazon has recently entered the privatization game, as probably a lot of people watching know. That kind of went around the interwebs the past couple weeks. And of course, a lot of people don't know this, but Google is in the vaccine game as well. So we have these major entities. Now our tech companies are merging with our pharmaceutical companies, all of which have a strong relationship with the government. So we have a very, very scary thing brewing right now. They do want to try to privatize all of Medicare and most of Medicaid by 2030. That's kind of the goal. That's kind of the trajectory of what we're seeing right now. And if that actually happens, I think we could be stuck. We could be really, really stuck. I support a national improved single payer bill. So something like HR 1976, which is Pramila Jayapal's bill in the House. It does need to be improved. It needs to cover everything, and we need to ensure that we have buffers to make sure privatization doesn't destroy that bill, basically. And we need to make sure our hospital, our healthcare workers and our hospital systems can remain functional. They get the funds that they need. So that's a huge undertaking to make sure all those things are in place. But a single payer model makes a lot of sense. It is one payer, right? Right now we have this really complicated system. We talked about how this is the most expensive healthcare system in the world by far. It is, but it's also the most complicated by design. And the majority of our hospital jobs are administrative. So imagine if we could free up some of those jobs, retrain people, and actually turn those people into healthcare workers, like care workers. We could really focus on our patients more. That'd be really, really cool, I think. We have pretty poor health outcomes, especially if you look at how much money we spend on healthcare, and infant mortality in this country is just embarrassing, to be honest. So it's just it's a brutal system right now. When you have we talked about, I've heard Pasta and Dr. Josh talk about taxes or taxpayer dollars or whatever. There's a lot of misconceptions with that. On the local level, you get, if you're doing healthcare on a local level, you would, tax the taxpayer base, whatever. You would bring in the funds and you would reallocate it however you want. But on a federal level, you pass a bill, you print money, right? And that can look many different ways, but you print the money and then you spend the money. Like, you don't have to tax people to do that. We don't tax people to pay for our $850 billion, and yes, that's how much it costs now, defense budget. We don't tax people to pay for Vladimir Zelensky's coke habit that we fund. So we do. So that makes the system so much cleaner. You have a single payer. The government pays for the thing. It makes it so much easier. And a lot of people don't know this, but Medicare for All is a deflationary event. It actually would make healthcare spending go down dramatically. Yes, there would be more federal spending, obviously, because that's where the money's coming from. But healthcare spending overall would plummet. So it's actually a deflationary event. You could actually cut taxes. So tell a Republican, hey, we're going to cut your taxes and give you health care. They're going to be like, yep, sign me up. So I think a national single payer model makes so much sense in this country. And again, private hospitals stay private, private practices, they stay private. So that gives you that sort of buffer that, you don't want the government with their talons in every part of the healthcare system. Okay, fine. National single payer, that works out for everyone. I think that's kind of a middle ground in my opinion. I know some people push for the socialized medicine, nationalized medicine. I think single payer is something that can be attractive to conservative people. Trying to think of what else I want to say about that. And then going past a national single payer program, we do have to keep pushing back against privatization. We have to keep pushing back against government allowing this and government corruption. There's a lot of corruption. I mentioned the Vioxx scandal earlier. There's a lot of the government and big pharma and big health insurance kind of colluding and covering everything up. We need some kind of fix on the other end as well. And I'm not really sure what that is necessarily, but we need to at least identify the problem and understand that there's a big mess. But I do think once you have a national single payer system, it really does kind of kill that for-profit model. Like there's still money to be made, obviously. But it's this idea that you can just deny claims for profit. That is absurd. And yes, you don't need private health insurance if you have Medicare for all, but you can sure go get it. If you want to stay at a shitty job just to have health insurance and pay copays and pay deductibles and get denied claims and have to find a doctor in your network. You can't go to that specialist across the street because they're not in your network. So you're not getting the actual care that you need. If you want to fight that fight, great. And if you want to get billed on the other end while still having insurance, you can have all that. But with national single payer, you get health care free at the point of service. There's no networks. You can go to any doctor you want. And we can actually take a lot of those administrative jobs.
Well, let's talk about that real quick. Let's talk about that because you talked about, now let me get this straight. You're for a federal program. You don't necessarily believe in the states getting their bills first or whatnot, or are you for state run healthcare? You're not. No. So, okay. And Scott, I believe that you stand behind some state bills, right? Okay. So let's table that for a second because you mentioned Pramila Jayapal's bill. Here's my problem with that. That's healthcare that is chosen for you as far as what specific healthcare you can get. In other words, there's nothing preventative. And this is what we're missing in this discussion because America's healthcare system, we're so desperate to get it. It's a battlefield healthcare system. It's like when you're sick, when you're hurt, we'll stitch you up, we'll get you better, whatnot. There's nothing preventative about our healthcare system. And with Pramila Jayapal's bill, it's once again, it's a certain healthcare that you have to adhere by. You know what I'm saying? And once again, if you have a healthcare system and what we just experienced right now, if you didn't get the jab in certain situations, you couldn't get other treatment. They removed it away from you. So when you look at Pramila's bill, isn't there something wrong with saying that you have to take this specific healthcare and you can't take that? You can't go into a preventative measures and look for that type of healthcare or that health down the road, Ricky?
Well, when I say I support national improved single payer, I think preventative and early treatments and things like that should be in the bill. Personally, I think there are, like I said, I don't think the bill is perfect at all. But yeah, preventative care, we never talk about that in America. We just don't care about that in America because we have so many other problems with our healthcare system. Doesn't even click for most people, right? Preventative care should be included it could be included in a national single payer bill. There's no reason it cannot be in there. But the problem is a lot of the problems that you're talking about, Pasta, come from the sort of the healthcare authority side, right? Which they're going to be there whether you have a national single payer bill or not. And I do agree with you that we need to check that out. That is a problem. They dictate. One of my biggest problems in the last few years that I've seen is how the health authorities have sort of just completely disregarded the doctor-patient relationship. That's Absolutely. One thing that I've witnessed time and time again, and it's not just one thing. It's many different ways they've kind of infiltrated the doctor-patient relationship, and it's bad. It's really, really bad. And that's something we need to all be aware of and learn how to address that problem. And that's something outside of a piece of legislation like Medicare for all. That's something else completely, but that's also part of the big picture. So it's not just passing a bill like Medicare for all. There's other problems that we have to address as well.
Scott, you got a question for Ricky? Something that you'd a little bit critical of the bill he's talking about, or critical of his system?
I mean, I actually agree with both of you as far as preventative care. I mean, the problem why we're all fighting for health care is because we're already all sick. All of America's already sick, you know?
Yeah.
So, yeah, and as you know, our biggest challenge is the media and the false narratives that they streamline out to us every single day, saying that the Democrats want to give you health care. So here's this contract that's going to deny you health care for their profits. Ricky's right on. Again, Ricky and I do disagree upon state-based legislation.
Yeah.
And I want to say that when I fight for state-based legislation, it is not because I just want to get New York health care, or else I wouldn't have been in Seattle last week collecting signatures for whole Washington. And I'm not trying to exclude Florida or Texas, because we both know that they are never going to get a state-based legislation bill on the table. My thought, again, is unifying. When we reach out to everybody and we have everybody interconnected, we have a network of people we can rely upon saying, hey, I have an action for healthcare and I need people to show up. And that's how we get this. That's how we get there, because we are not going to get people like our Vice President Kamala Harris, who shared my son's story as a commercial for the ones who murdered him. I could get into that if you'd like, which is why I'm supporting Whole Washington, which has a ballot initiative to get around our corrupt politicians. We all see the uphill battle we have and the hurdles that are in front of us. And, Ricky, even though we've disagreed on point, thank you so much for working with us when we can.
But Scott, let me ask you a question while we're on this thing, and I'm going to hand it over to Dr. Joss for his criticisms, constructive criticisms. Isn't it like, because Fiorella's talked about this before, right? So we have a lot of states that that advocate. The politicians go out there and they advocate for Medicare for all. You talked about Democrats, like California, for example. It seems like a giant virtue signal at the end of the day, because it's something that the state will never give. And if we do make that happen, then there's, it seems like we're working hard, not working smart, as if we just push for a national program that it will involve everybody. So these, instead of going state by state by state by state by state, it just seems like we're going the long way home, rather than just advocating for that national program, which all states will then be covered by a universal health care program. Go ahead, Scott.
Yeah, I don't know how many of these state-based actions I've been at. It's many, very, very many. And none of us are actually just supporting, we amplify the national at the same time that we're advocating for our state-based legislation. So it's not this or that. Every single state activist I know are like, well, with Joe Biden saying he'd veto Medicare for all, with Nancy Pelosi saying she's not a fan of Medicare for all, and like I said, with my son's example with Kamala Harris, we know we're not going to be able to move those people to do it without a lot of people on the ground demanding it. And we have this network of state-based people that we can lean into and get them on the streets with us. That's where I'm at. Again, fighting from every angle to remove the monsters that profit from our healthcare. And if I can remove 1/50th of their profits in New York, and then get another 49th of their profits out of Washington, they also have to divide their resources to fight us on all these separate fronts. And they do. They spend their money to fight the New York Health Act. They spend their money to fight CalCare. They spend their money to fight whole Washington, just as much as they're spending their money on a national level. So that's our thought. Just divide and conquer these assholes.
I hear you. Dr. Josh, do you have or Ricky, do you have anything to say about that? I think that you guys are kind of on the same page there as well, just different tactics. Do you have anything to say about the whole national versus state argument, or and then we'll hand it over to Dr. Josh's question.
Yeah, I just think we need to all focus on national. That's just my personal opinion. Just all in on national. I think we're dividing and conquering ourselves by trying to go all around the country to pass these bills, which they've successfully squashed, even when the votes were there. Right, the party somehow, I don't know what message they sent down the line, but they got people who were supposed to support the bill to squash their own bill. So, we really need to make a stink nationally, because a lot of these people that live in the middle of the country don't even know that these battles are happening in California, in Washington, in New York, and they've even happened in states like Colorado and Vermont. Even tried it. People don't know that these things are even going on, but people know Medicare for All. That's the one healthcare bill that has momentum. It's the one brand name that people know, and there's a reason why it hasn't passed. If it was so bad, if the government was going to have so much power, why would a bill with a 60% approval rating across the country? Why wouldn't they have already passed it? They would have done it. They don't do it because private health insurance lobbyists clearly don't want it to happen.
Let's get to Dr. Josh's criticisms. I know we're running low on time, and Dr. Josh is a doctor, so he might have a patient coming. Dr. Josh, what are your main criticisms towards Ricky's ideology when it comes to Medicare for All?
Well, I don't know about the other guys, but I think we're going to need a part two. I'm loving the conversation because I think 80 to 90% of the facts are correct and the conclusion is wrong, right? So at the same time that you guys talk about how much we dislike the government, right? I think that's a unique aspect of this podcast. Is no.
Well, I hate the government more than anybody here, so I just want to put that on record. I despise them. I can't stand them. But
well, and so that kind of begs the question: why do we keep asking them to fix it? Right. At the same time that Ricky is saying the government is corrupt with big tech, is saying, let's get government to fix this. Right. And if we can't prevent the government from being corrupt now, we'll have even less chance when there's one entity. And what I would say to Scott is right. We need a community to build up momentum. The way you do that, though, is through a business. Apple has a community. And as such, I'm talking to you on a supercomputer that didn't exist 12 years ago, right? And it's only better, faster, cheaper, easier because a lot of people got together and demanded a better product, a better price, transparency, trust, etc. Right? So what you could both actually have almost all of what you want if what you focused on was the patient care and not the payment source, right? And the problem will be with the federal system is the slowness. So if we don't like Trump, just for we can all probably agree here, ironically, that the population has never been so divided, right? So the same people who have Trump derangement syndrome why would you ever want the government to run healthcare? Because you'll probably hate the next Republican as much, and vice versa. If you hate Biden, why would you ever let Biden have ultimate one down top only control? And where I respect Scott's position a bit more, because he's, I would say, more consistent, no offense, Ricky, is government only, no insurance. Ricky, your flaw is that government with insurance would eliminate the value of government. Because the government can't do the DMV now. I would argue they don't do public schools well now because there's a lot of debate on that quality. And schools is the closest to what you're recommending now. 90% of schools are government funded, top down, controlled, everything, employed. You're not even arguing to employ the doctors. So I would argue that your system would say it's a universal payer. That's great. Who gets to decide the rate?
Go ahead, Ricky.
Presumably, right?
Yeah. Let Ricky respond to that.
Sure.
Let him respond to that. I'll give you a chance to push back. Ricky, he says you're inconsistent, and he's saying plain and simple that if government is so bad now, how is it going to be better once there's just the government and there's no, sorry to do this to you, Dr. Josh, free market controlling it? You know what I'm saying?
I mean, the government always
Being
sucks.
honest.
The government always sucks, right? But a national single payer system takes the burden off of the patient, first and foremost. So that burden is lifted from patients. Our sickest and most disabled people in this country don't have to jump through hoops to get the care they need. They can go to any doctor they want. So that it frees up that right there. Yeah, there will be.
No. So can I take point with that? Because I think that's a key part of your argument, and it's not true. they can
just give him time to
any,
respond. So go ahead, Dr. Josh.
if they can go to any doctor they want, they can only go to doctors who accept that government payment. So you're either talking about involuntary servitude, all doctors are required to work for the government. Well, then you'll have to make them government employees, give government benefits, give them retirement and paid days off. So what happens when I close my office like the bank does for federal holidays or school, right? But you're not arguing that. So then if I have a choice as a physician to take the government money or not, as I understand your argument, is you're creating a two-tier system where the government will be there, but if it doesn't pay enough, the people will have to go, if they want a different doctor or a doctor who thinks they're better than what the government rate will be. My fear is you market Medicare for all, but what will be delivered is Medicaid for all, substantially different.
Ricky, go ahead and respond, because I feel like we're getting a little bit of Rand Paul Bernie Sanders argument about the servitude thing. I know that when Dr. Josh said that, I was like, oh, here we go with this argument again, where Bernie said, is there a problem with people knocking on your door and forcing you to give health care? Go ahead, Ricky.
Well, I think a doctor would be crazy not to take government money if the government money is good. So we do need to make sure that the government takes care of our doctors. This is part of my argument too, though. The bill has to be improved. It's not good enough, but you can ensure that there's a system in place to make sure that, you know, the costs are covered, the overhead's covered, and there's a good salary for these doctors. A lot of doctors right now, they make their salaries by pushing drugs that they wouldn't necessarily push onto their patients. So we have a shitty system.
We do have an incentive I know the big pharma comes in, the pharmaceutical companies, they do grease the wheels of a lot of doctors for selling their drugs, Dr. Josh. Go ahead.
That's not even true. You can go look this up. The name escapes me. You can go and look up how much I've been paid by, pharmaceutical companies over the year, and it's dozens of dollars and mostly meals, right? And mostly for my staff. So there's not a widespread conspiracy. That's just factually untrue, like your infant mortality stat. So I'm no insurance-based doctor or direct care doctor or insurance-free is making the bulk of their salary from prescribing medicines, right? There's no payment structure there. The reimbursement is coming from Medicare or private insurance. Now you can chart in a way that's more complicated, and the more complicated you make the patient look or is, the more you get paid. And part of that is saying whether you prescribe a medicine or not. There's no direct that is Medicaid saying, if your patient's more complex, we'll pay you more. One of those ways you can document is I put you on, you were complex enough to need a medicine, but that's no money coming from pharmaceutical. So that part is factually just not true. But also you're saying if the money was good, then you'd be a fool to take it. The money's not good. A doctor could not be sustainable. I know Steve's Scott would not like the word profitable, but a doctor could not keep his doors open if he had 100% Medicaid patients. Doctors lose money on Medicaid. So this at the state level, and that's part of yes, I would be the expert in the room, is Medicaid does not pay the doctors enough. So they lose money on that and thus limit the number of Medicaid patients they'd see. Medicare is close, but most doctors, short of being a geriatrician and focusing on and making more money because you see fewer patients who are more complicated, you would not have a standard practice just full of Medicaid.
How would you fix that problem, Ricky? How would you fix that problem? The doctor's pointing out that Medicaid and Medicare don't pay enough. How would that be fixed in your?
Medicare for all isn't Medicare, and it's not Medicaid.
Okay.
First, national single payer. That's what Medicare for all is. It is a national single payer system. It is completely different than Medicare. It is completely different than Medicaid. So we have to really put that aside, because right now Medicare and Medicaid operate in a system that is also a for-profit model. So you have all these competing things going on. Right, you don't have that fear when you have a national.
Let him finish one
system.
second, doctor.
The dollar signs we can print as much money as needed. Right, of course, the government is still a hurdle. It always will be a hurdle, but we can pay doctors as much as they need to be paid. We can pay nurses as much as they need to be paid. We can make sure hospitals are funded. It's really not hard. Again, we can pay $850 billion into defense. We can definitely do it for our healthcare system, and it's still cheaper than the system we have right now. No,
because the healthcare system is $3.2 trillion. Heading towards $4 trillion. So it dwarfs the military budget. And I think you hand me the victory when you say just print money. In a time period where we have 41-year record inflation because we overprinted money. The answer to the affordability.
We're getting into the MMT part of the show where we. But I agree with Dr. Josh here. We start printing from the printing press. We're devaluing our currency.
The funny thing is, I can fix this for you, right? You say print more money. I say make the medicines cost less. I say make the medicines cost 95% less. Don't print any more money, right? So even if you got to your system, but again, I think it's disingenuous because you want to say Medicare for all is the name that people use and know, oh, but the national healthcare system won't be Medicare. Okay, it'll be different, but it'll be better, but it'll be government, but we don't like government. And what I can say is remove the cancer that is your solution. If people band together themselves, they can get better, faster, cheaper, easier healthcare on their own, and they don't have to worry about not liking the next politician. They don't have to worry about big tech trying to take what they, the information or getting involved with the government. It's individual freedom and the personal plan. A good example would be a small business, a couple years back, 45 people, a gardening center. We decreased their insurance premiums by 50% after they paid for our memberships. So it was a small business. They got the same insurance or better. They paid 50% less. They got unlimited 24/7 access to a private physician. And then they used that money to give extra benefits such as, cafeteria plans and some raises. So in the right solution, you pay insurance less, which takes away from big corporate insurance like you guys want. You pay the government less, you pay insurance less, you pay your people more, and you get more care more often for less money. That is the solution, is to fix it. Make meds cheaper, labs cheaper, procedures free, eliminate copays, decrease insurance premiums by at least 50%, give people their own money back. If we don't like politicians, we shouldn't be giving politicians control, at least to start with. Because what I would say is we are both a startup. You're trying to boil the ocean. Let's go straight to the government and get top-down everything. I would say if you wanted an effective go-to-market strategy, you would say, let's take over all cancer care, right? Because you'd get this disproportionate value. All cancer care, everything, surgery, radiology, meds, makes up about 5% of the system spend. So take 5%.
Let's let I know we're running over time, Dr. Josh, but let's let Ricky respond, and if Scott has anything else, and then we'll wrap up the last part of the show. I know what you're saying, Dr. Josh, but let Ricky respond to the whole top-down theory of like how we fix this, because I don't have the answers myself. That's why I'm having this show today. But let's let Ricky respond to that. Go ahead, Ricky.
I mean, in a perfect world, we wouldn't have the government that we have. I would love like a parallel society where we didn't have to deal with this top-down structure. But as long as we're operating in it, and our sick people are operating under it, and our disabled people are operating under it, they need for some people. I mean, what people are going through right now. So when I hear this whole printing money, it's nonsense. We can print as much fucking money as we want. Listen, you can print as much fucking money as you want as long as the money is going to where it needs to go. As long as there's supply and demand and the money is actually going to where it needs to go, you can print as much as that shit as you want. It really doesn't matter. Right?
The more you
only get inflation when you print a bunch of money and give it to fucking Google. You give it to fucking Bezos. And all of a sudden he's got billions and billions and billions more, and you still have the same $5,000 in your bank account, poor person. Congratulations, your money is devalued. But if you actually if you print billions and billions of dollars, put it into a healthcare system that everyone's participating in, guess what? You're not going to feel that so much. You're going to get healthcare free at the point of service, right? Yeah. So you have to really learn that printing money printing money isn't the fucking bad guy. The bad guy is printing money and then giving it away, giving it to Ukraine,
it's where the money goes.
Giving it to Bezos, giving it to Zuckerberg. That is how you print money in a way that's a disaster for the working class. Printing money isn't the actual issue.
I love how your solution is print more money, not lower the price by 95%.
That does lower the price by 100%. It makes it free at the point of service.
They can make the price go up too. I mean, there's yin and yang in here, guys, and I think that Ricky did hit a point that it's who we give the money to that's a problem. I don't necessarily agree that we can print as much as we want, because scarcity is what keeps the value in our currency. We have a global currency I've been down to the global south, and the more money there is, and we've seen what happened with Venezuela's cash at one point, because of their blockade and the sanctions and every kind of filled in, where they had a lot of money and it was devalued. And we could do the same thing in America, especially when we're going into a multipolar world now, where the ruble, and the yen, they're on their own. They're moving away from our dollar. So, I think there's points to each end. Guys, I know we can go on forever with this conversation. I just want Scott to get a chance. He's been patiently waiting on the sideline. Scott, I'm going to give you the last word really quickly on this particular section. And then, gentlemen, we're going to take 2 minutes each and to just wrap it up and give us your last thoughts on what you thought about today and what you think about moving forward. So, Scott, if you got anything to add to this conversation?
No, I agree with Ricky as far as how we pay for it nationally. We write in the budget, like I said at the beginning of the show, just like the failed F-35. That's how we pay for it. There'll be all sorts of politicians claiming afterwards that that's why we need to tax this and tax that, but it's already paid for at that point. As far as from the top down, that is the approach on the federal national level that we are all fighting for, and we do need people in the streets. I just happen also to believe grassroots from the bottom up. We got to get people in the streets over and over. I don't know how much more I can implore our listeners to hear that message. People in the streets. Yeah. Show solidarity.
I agree, but I think we still need to come together first and figure out what we're getting in the streets for. I think that's the big problem, Scott. I think there's an issue where there's some people right now it's just simply not ready to hand their health care over to the government. They see what the government has done. Now, I don't necessarily agree with Dr. Josh where we should put it in the hands of the free market, because I still think there's a lot of hazardous things that could happen in that way. But at this point, I'd be willing to put it in the hands of the people over the government. But, there's a lot of questions, a lot of things to go up. Scott, just take a last 1-2 minutes and wrap it up. And then Dr. Josh, you go second, and Ricky, you'll go third. And we'll get you out of there. Sleepy, if you could put Scott on the big screen for his final 2 minutes, that would be great.
Yeah. Thank you so much for the last 2 minutes. Again, I'd just like everybody to remember, insurance companies profit when they deny us care. There's no clearer message that I can put than that. We have to remove the profit motive and put our patients, our loved ones, in front of the profit motive. The patient's needs are more important than companies making money. And every person that we lose, when we hear the number 68,000 lives a year, they're not just numbers. They're people. They're our mothers, our fathers, our brothers, our sisters, our children. Those are the ones we're fighting to make sure that people don't profit from their suffering and from their deaths. Get out in the streets, join every action that you can join, and help with the movement. You've got to stand up, because they are not going to stand up for us.
Thank you so much, Scott, for sharing your story and coming on today. Dr. Josh, take a couple minutes. Thank you so much for coming on here and stepping into the the Thunderdome over here. Whatnot. We do appreciate it. Give us a couple minutes on what you think, what you heard today, and how we can move forward when it comes to healthcare.
Yeah, it was a blast. Thanks for having me. And I think there's a lot of discussion that we could continue to have. I would say, unfortunately, they're handing me the victory. The idea of national change has been talked about for as long as I've been alive, and the result has never been anything satisfactory. So it will continue to rage against the machine, to hate government and ask for government to fix this, knowing full well that government can't provide health care, isn't very efficient, and nothing happens quickly. It'll happen on the span of 4-year election cycles, and then be dangled out in front of the populace they may or may not change what we will or want to do, but they'll never actually input it. And I would say the Affordable Care Act is a great example of that. Great intentions and poor delivery, poor result, and people are worse off for it. If I was in charge of the libertarian message, it would be like Scott. Let's unify on as many things as we can. Let's not let the enemy, perfect be the enemy of the good. And if we can decrease cost of meds by 95% by giving doctors and patients more knowledge, we should. If we can decrease cost of labs by 95%, that's huge. We can eliminate copays, make doctor office procedures free. We can decrease insurance premiums by 30 to 60% the first year, more if the government, laws were more flexible. Embrace HSAs for people to save their own money and make their own decision, because I think if all politics is local, all healthcare is even more local. And the closer the money is to the person needing the care, the better the decision is. And this is something we can do now. Everyone else is waiting for permission from the government to have a solution. And this is a solution that's growing and thriving and helping patients and small businesses now. So the populace is tired of rhetoric. I think it falls on deaf ears, and they go back to their party lines. What they need to hear is, here's a real solution that you can enact now. You're a doctor. The next time you go to them, ask them to do wholesale meds. Docs in 44 states can. Pharmacists in all 50 states can. Ask your doc for the cash price of things. The emperor's new clothes, the fallacy is that things are cheaper with insurance. I can check your cholesterol for $3. I can check your thyroid for $1.80. Healthcare is too cheap to insure. And then the conversation Ricky and Scott and I can have, and Pasta, would be, how do we ensure what's left? But the reality is such a small portion would be left. So real victory comes, I don't think, by fighting the system, right? Google didn't try to work with the government to make what was a good product, at least at a time, and Airbnb didn't work with the hotel chains, and Uber didn't work with taxis. So often we do have to get comfortable stepping out and let's make as much progress as we can, as fast as we can, and not wait for what we all agree to be a broken electoral system.
Thank you, Dr. Josh.
Sure.
Go ahead, finish up your last sentence.
Just to enact as much change as we can as quickly. So concrete, Main Street, real solutions that people can hear, see, believe, and get.
Yeah.
Not promises of the future, things they could go and ask their doctor for tomorrow.
And where can people find you, Dr. Josh? Because this little, all those libertarians, they got that little anarchy in them. Let's, there's rules, just no rulers. But where can people find you?
We have a website, atlas.md, and they can go there. We have a live chat. They can email us. That's for our software side. That's probably the easiest place to find us.
What's it called again?
Atlas.md is the website.
Atlas.md.
Yeah.
Perfect.
But just Google direct care in your city and talk to the doctors doing it.
Scott, I forgot to ask you real quick. Put Scott up really quick. Scott, where could people find you and the Red Berets?
The Red Berets are mostly active on Twitter. You can find me at Scott Desno, SCOTTDESNO, or Desnoyers Scott. Scott Desno would be easier to find me. Or just look for hashtag Red Berets. Yeah.
Ricky, you got a couple minutes to bring it on home, man. Your man was over there talking about parallel systems over there. So give us your last shtick and send us on home.
I love the idea of anarchy. I really do. It's just really hard in the world we have today, and a lot of people are very comfortable and apathetic, right? I would love to start over. I would love to start the whole system over. That's my perspective personally. I'm just trying to think of what makes sense, what is logical. I will disagree with you. I don't think the Affordable Care Act was, a nice try or the right idea. People trying to look out for others. I think the Affordable Care Act was a handout to, private insurance. I think it was a straight up, here you go. We could do something like national single payer, but here's this system. And now the American people are going to think that this is what the system has to be, and they think that any bill that we pass will be this, and that's just not the case. They did that because it was a handout to the private insurers that donate to their campaigns, and that's what it was. Just like Obama on day one didn't prosecute any of the people who committed crimes on Wall Street that led us to the 2008 recession. He bailed them all out because the banks were in his ear and funding his campaign and fund the party, right? So no, that wasn't a try. That wasn't a try. Medicare for all, national single payer is the try, and they won't do it because that's actually what threatens those lobbyists. It's what actually threatens the for-profit system that is predatory. I just think it's the best option for what we have right now. If you get into a car accident and you wake up in the hospital, you're going to get slapped with a bill. They're not going to be like, you want to do the wholesale option? Now, if we can bring that option to the entire country, let's talk about it. Let's do it, but you're going to get slapped with a fucking huge bill. Sorry about it. If you faint while you're doing a marathon, you might wake up in the back of an ambulance. Boom, you got thousands of dollars right there. Like ERs, like no one, like these things cost so much money because of the broken system, because these private health insurers are siphoning billions and billions of dollars out of the system. Most of the money in healthcare does not go to care, period. Now, a clinic might be able to come up with a model that is affordable for people, but if emergency care, hospital care, ambulances, none of this is going to be covered by that unless you have a way to transform the entire system. So that's where I'm coming from. National single payer could take care of all of it. It really can.
Again, I say thank you, because the likelihood of that happening all at once, top down, is so low that it gives us plenty of time to continue starting over, creating the system that I think we both agree we want. But we're actually building it. We're recruiting customers. We're showing value. We're showing that we have to be better, faster, cheaper, easier than what they have. And you're right. Other pieces are broken. That's not an argument we disagree with. But I can do stitches that the ER would charge $1,000 for. We do for free, right? So there is a enormous potential for solutions, and that's where I blame doctors for not being accessible. And
I think you guys got to hook up after the show, definitely, and talk some more whatnot. We got 5 minutes. I got to get out of here. Ricky, last statement, last push. I mean, it's tough, Ricky. I just so distrust the government so much. I don't think they'll ever be the solution. However, I know where you're coming from, but go ahead and wrap it up. We got to get on out of here. So please, I didn't mean to cut you off there, buddy.
And the government can always change the rules, man. They can shut down your practice any day of the week, man. They're revoking licenses from doctors who just want to treat their patients right now, whatever that might be. Because they decide that you're not treating them the right way, whatever the politics behind that is. Like, we've seen that. So they could come after you. They might come after you. I hope they don't, but they could come.
And this is the government you want, though.
I mean, they're there anyways. You're not eliminating the the just by having these. I get what you're saying, but you're not eliminating them, and you're not eliminating their overreach just because you have these businesses.
Power.
All right, we got to wrap it up. This is great. I love it, and it's still.
Let's take over the government, Josh. We're gonna take over.
See, no,
you're gonna be there no matter what. That's the thing.
Close. You would say take over the government. I would say take over the market. Other than that, we are actually very, very close.
Let me read some super rays real quick so we can address these things. And electoral politics does not work in the barbaric, genocidal empire. Only a true revolution will allow change. Omar Grant said that. Thank you for the super ray contribution. We've been talking about it over here. AM Wake Up. Steve is hanging out. We don't have healthcare. We have a sick care and symptom care. The Western medical system is based on keeping you sick and giving you new illness. Healthcare is gut biome maintenance, exercise, meditation, and touching fucking grass. That was the first curse the whole show, guys. Hey, Dr. Dragon says yes. Thank you, Dr. Dragon. And AREM, longtime listener and supporter of the show. Thank you, AREM. I suggest prepping the ground for a single payer system with what I would describe as the hit the ground running legislation. One example is building more local health clinics. Also, a template for a state or federally funded healthcare system was done by the Public Economy Research Institute, the PERI, from the University of Massachusetts in Amherst. This should be done. Corporate excess must be curbed. I don't know. We didn't talk about this today. What if it was just a funding mechanism, Dr. Josh, by the government, which let you go spend money and other forms of healthcare you wanted? I mean, if there has to be a government there, why not implement that system where they say, okay, those who need it, those in need, the lowest among us, the sickest people, the people with illnesses, the poor people, whatnot, why not have a funding mechanism where they get the money and they get to go choose to use it wherever they want?
Well, I kind of actually did mention that in the sense of the food stamp model. I think that I wouldn't say it's perfect, but in the sense that we, grade your need, we give you cash, we let you go in the community, the market holds the price of goods and services down, and then you have the dignity to shop like every other consumer. and no government paperwork required really for the supplier of those goods, grocery stores, et cetera. So, we did this math for the state of Kansas, but roughly, if you gave me, my normal prices are $10 a month for kids with an adult. So roughly, if the state gave us $30 a month for kids on Medicaid, that would cover their membership and most meds and most labs, and we'd be done. So they could give them that money, give them a little extra if they want, let them keep that money like an HSA, so that they would be incentivized to use it properly, and we could have saved the state of Kansas $1 billion.
So you do have a place for the government, then, maybe in
a little bit. As I dislike the government, I agree with all of you guys on the dislike of the government. I as opposed to, I think, to burn the system down, my solution is anti-fragile. I don't need the government to disappear. If they're going to be there, let them be there, but make sure they're buying the most cost-effective product. I want them to be buying the medicine at 75 cents a month, not at some markup rate, because the government's already proven they're not very good at getting the best value. So if they communicated, with the patient, and the patient made that decision, the patient would say, I'm not buying name brand Lexapro at $12 a pill from Walgreens. I'm buying generic Lexapro from, Dr. Josh at 3 cents a pill, to, $1.20 a month. And then I keep the money for other stuff.
I think the question is, why do we need Lexapro so much? Why is it thrusted on people? Obviously, the government, these pharmaceutical companies have made deals, whatnot, and they've poisoned us. There's so much stuff to discuss when it comes to healthcare. I think we just hit the tip of the iceberg. Maybe we should have a round 2, guys, and we can come back and talk about more things. Guys, thank you so much for coming on. There's Ricky Rance, Scott D., Dr. Josh. I am Pasta Jardula. This is the Convo Couch. This is a discussion about the future of healthcare. Guys, thank you so much for joining in. Thank you for all our Super 8 contributions. Fiorello will be back with me on Friday, and we have some great guests planned for us in the future. Actually, a guest to talk about our healthcare system coming up soon. I don't want to spoil the surprise, but we'll be having much more conversations about that. If you haven't joined our Rockfin, ROKFIN, please go over there, the Convo Couch. For Sleepy Josh on the 1s and 2s. Sleepy, you got anything to say before we get on out?
Like we all got to, like, I kind of agree with we need to drop the cost. So I like that aspect of it, but I think y'all should do a part 2, because I haven't seen a doctor in 8 fucking years. I have SBT and I've had 7 blood clots. So
you need
it's
Plavix.
a problem.
Yeah.
I need all kinds of stuff, but I can't see a doctor. So
I know the system is so jacked up.
Look for direct primary care, $50 a month. Reach out.
Yeah, you ain't gonna find that in the Bay Area.
It is. Well, maybe not quite that cheap, but you could also use telemedicine to find a doctor a little farther away at a better price, right? Because that's what we're doing.
I also can't drive because I pass out randomly. So
Well, that would be the benefit of telemedicine, right? And most docs weren't reimbursed for telemedicine, which is why they never did it. And insurance didn't want to pay for it because it would make it too easy to run up claims. So the ironic thing is that you could be using the technology that we're using right now. Well, we didn't have to drive to each other. Why limit your health care to your zip code? And especially if you can't drive. So then you could choose a doctor anywhere in California or presumably other states, depending on doctor's license, and find them, the restaurant near you has a very high overhead if they're in the San Francisco real estate model. But that doesn't mean you can't get food from another state sent to you, or other examples.
And telemedicine, by the way, worked for when it came to you didn't say, I can't say it out loud because we're on YouTube, so I can't say the word, but telemedicine did work and help with that when it came to the boop boop. Instead of getting the boop boop, other forms of alternative medicine. Gentlemen, thank you so much. We'll get a part 2. I know there's a lot to say. It feels like we just got started, but I love you all. You're amazing people. Combo out, guys. We'll see you back, Combo Couch, on Friday at noon. All right, guys.